your brain on menopause. Super excited about this. So having a look for our guest today, who's going to be talking with us about the menopause brain, and we even have a giveaway at the end. Isn't that amazing? Super amazing. So let's just look for our guest. Here. Come on in. So excited to be inviting you. Hello, everybody. Hello, everybody. Hello, Maria.
Hi, how are you?
I'm doing great. How are you?
Good. Let me adjust this. So let's see. More of my face is in the frame.
Yeah, we want to see
Yeah.
your beautiful radiance today. How's it going?
Good. It's great to connect with you here.
Yeah. We still need to see a little bit more of you, I think.
Okay, let's see. One more book off the stack. How's that?
Yep. We could even take one more book off the stack.
Okay.
Get you a little bit of the screen.
So without toppling the whole house of cards.
Oh, yeah. Topple the whole house down. So yeah, really excited to be talking about the menopause brain today, and I understand we have a giveaway going on, so you'll be able to.
Yeah. So 2 lucky people who've been selected are going to win a copy of this book. So yeah, a content strategist for Pandia Health, and also on this menopause journey, like everyone else here, probably here. And so really excited to see this book coming out that explains so many things that happen. So
yeah. And do you know a little? I mean, you've shared with me already a little bit about the author. So why don't you tell me what you know about the author, or what's excited you about this book?
Well, it was the fact that it was a neuroscientist who really has delved into understanding these processes and connecting sort of menopause with the brain. And it just really, like I said, it provides such a great explanation for so many things and so many phenomena that people experience. So I think that's maybe our time is short. We're trying to keep this to 30 minutes. And so we're going to dive into the questions.
So first of all, I'll introduce myself.
Oh, first. Okay.
Yeah, that yet. So I'm Dr. Catherine Hansen. I'm the head of menopause at Pandia Health, and we love having these conversations. And this is such a great topic, so thanks for bringing it to us. Dr. Lisa Manconi, the author, also wrote The XX Brain. So it doesn't just have to be menopause, but also how do we protect our brain from all of the things that can happen at all of the ages and stages of our life, because as we're going to hear today, the brain is so sensitive and so responding to so many of the hormones throughout all of those ages and stages of life. But yeah, let's hear what you would like to know.
Yeah. So what would you say, just to kind of level set, how would you explain what is menopause and what have we missed for so long in our understanding of this transition?
Yeah, so by definition, and we always kind of have to do that definition, menopause is the anniversary of the last menstrual period. So that's kind of like a day in time when we've been a full 12 months. I think the most important part about that is that a lot of people will wonder, are they through menopause? And after that 12 months, if there's any bleeding, it's actually an issue. And so we need to kind of know when that is. We sort of need to know when our last menstrual period was, or estimate that, and then know that we're basically, menopausal. So there's perimenopause, there's approaching menopause, there's that day of menopause, and then there's postmenopausal. And all of those different ages and stages are so vitally important.
Right. And then thinking about, how do you think we've really understood that the brain is part of that?
Well, I think anybody that's had menopausal symptoms, myself, and sounds like maybe you included, know that the brain does something at menopause that is just very, very confusing. And I think that it's so important for people to understand that the brain is responsive to hormones. And as estrogen declines, progesterone declines, all of those things can contribute to some symptoms that are not like necessarily clear, right? Like we forget things. We're not sure where the keys are. We try to put words together or put sentences together. I know professional women may be in situations where they're having presentations or projects, or they're really trying to be clear in their, in their executive function. And those things start to really give us some trouble. It feels very foggy. And of course, Maria, when we add to that the fact that we're also not getting sleep because there's sleep disruption, and the lack of estrogen can lead to a lot of sleep problems, it really throws things off for us in the daytime when we're trying to function.
That's so true. So yeah, so the takeaway, it's like menopause is that 1 year anniversary since the last period, and that it's a neurologically involved process. It's not just about reproduction per se. So, and kind of following up on that and reading the book, I was really blown away to learn that the female brain runs on estrogen. So knowing this, like you were saying, that explains so many of the things that a lot of us experience, such as, brain fog, having a, hard time remembering words. What are some of the other things that you've seen in your kind of practice and working with women that are kind of things that start in the brain?
Yeah, so I think I can't underestimate the importance of sleep. And so when sleep starts to fall off, we really feel like, everything else is related to that. And so that's probably one of the biggest factors. We know from very, very, very recent studies that even though that there's this timing of brain fog and sort of a temporary reduction in that sort of cognitive function and that ability to really think clearly, that has been measured. And so women who may think that they're going crazy or think they're getting early Alzheimer's disease or early dementia, like this is, like you say, estrogen's effect on the brain, or estrogen's decline effect on the brain. And it's real and it's measurable and it's temporary. So I think that's what people need to realize. Not that you need to suffer through it. We're going to talk about treatment in a minute, but really it is temporary. We need to have loving compassion and self-care, and just really know that these are the things that are happening to us. So those are the things I see in the office. And sometimes, honestly, people will come in because they're terrified. They don't understand what's happening. And when we can't think straight, it's pretty scary. It can throw us into a survival mode or an anxiety, a real fear of what's happening.
Yeah, no, that's totally understandable. But it's good to hear you say that it's something that's temporary, that it's a phase that
Right.
we went through, just like, the book makes the point that we went through puberty and that caused some disruption. And so, but we got through that. And so also this too shall pass.
Right. And you're right. I'm glad you mentioned puberty, because I liken it to a lot of people when I talk with them to PMS. And if people had really severe PMS, that's when the estrogen and progesterone are falling off in that latter part of the menstrual cycle just before the next period. And those symptoms are often what we get when we're feeling, the symptoms of perimenopause. So not just the brain fog and the lack of sleep, but also, things like irritability, overwhelming sadness, anxiety, anger, rage. I've had women come in and literally the reason they're there is because they really start hating their husband or their partner, and they're not sure why, and they don't want that to be part of their future. That's not their new forever.
That's good to know. Yeah, I think another one you mentioned is the whole idea of just overwhelm, because this is a time of life you're kind of in the middle of maybe having children or helping raise them, maybe taking care of parents and working, and it's a lot.
It is. And I'm so glad you mentioned that too, because we need to normalize that there's hormone, issues going on, and there's life issues going on. And all of these things compound around this time in life when we have, usually growing children, potentially teenagers or adult children who are having their own challenges. We have ailing parents, and then we have our own professional momentum around this time. We're really hitting it hard, usually in our careers or around the projects and creativity. All of that is culminating at this time of life, and then add to that the hormone issues. Boom, we feel like we're the only one, and we don't know what to do.
Yes. So one of the great things is that the solution to this for many women find is menopausal hormone therapy, which is also called HRT, and you're leading that practice here at Pandia Health. But many women are still scared of the idea of hormone therapy. They've seen maybe old media reports or heard from some MDs that I'm not sure if that's safe. So I was really happy to see that one of the most reassuring and affirming parts of this book, The Menopause Brain, is in chapter 9, where Dr. Mosconi really handles these myths, hopefully once and for all. How would you kind of sum that up succinctly?
Yeah. So it's nice that she's really put this together in an entertaining and engaging way. We've been trying to say this since the Women's Health Initiative was published in 2001, 2002 timeframe, exactly when I was graduating from my OBGYN.
Wow.
And what we now know to be true is that the medications that were studied in that Women's Health Initiative were not generally the ones we would recommend as first line. They're still available, they're still great, they still do their job, but they're not necessarily first line. So conjugated equine estrogen, which is literally an estrogen that comes from horses, pregnant mare's urine, so horses, and medroxyprogesterone acetate, which is a synthetic form of progesterone. So there's different types of estrogen, there's different types of progesterone. The ones that were studied are not necessarily the ones we would recommend now. Mm-hmm. And there's, several reasons for that, but that is part of the issue with the Women's Health Initiative.
So totally different medication than is being used now. So that's a big difference. And they work differently in the body, it sounds like, as well.
Yeah. And just to be clear, those medications still are available. They still work well. And a lot of people, it's interesting, we've done this, we've talked about this before at Pandia Health, but a lot of people want things that are natural. Mm-hmm. And that's pregnant mare's urine is natural, right? We don't want that. So let's think about it. Do we really want something natural? What's natural? A plant, an animal, or a mineral? Mm-hmm. All things, even natural things, have to be adapted in a lab in order to be taken in the form that can be used by our body. Otherwise, we would just go out and eat a big plant. So we've adapted things in the lab, and adapting things in the lab is essentially a synthetic process, but people don't want to use synthetics. So what do we do to kind of bridge that gap? We have something natural. In other words, it's plant-based. It's adapted in the lab so our body can use it. And we have what's called bioidentical hormone therapy. So bioidentical menopausal hormone therapy. That's what we prescribe first line because that's what women want to use. That's what we think. We haven't done a study as big as the Women's Health Initiative, but that's what we think is likely more, safer for people in FDA approved versions, in dosages that are safe and studied and appropriate, in certain women who are assessed and evaluated for it to be safe. So I think these conversations are, important for us to realize we've come a long way, baby, since 2001, since the Women's Health Initiative. We're using different medications. They're bioidentical or body identical. And we now know a lot about when we prescribe them because the Women's Health Initiative, of course, studied women whose mean age was 63. So women who were between 60 and 70 were incorporated in that study. There were a lot of older women in that study who, by nature of age and lifestyle, would potentially have greater risks anyway, whether they are taking that medication or not. So that's an important factor about the Women's Health Initiative results.
Okay, so what if we learned about that timing window that's really important today?
Yeah, so the timing hypothesis, which has come out of the Women's Health Initiative and some subsequent studies, has told us that when menopausal hormone therapy is given in appropriate forms, and often that's the bioidentical, body identical ones we're talking about that are FDA approved versions. If it's given within 10 years of menopause and under the age of 60, so 50 to 59 age group, so kind of hitting it as soon as you start to notice that those hormones are lacking and you're getting symptoms, it's the safest.
Awesome.
And really is incredible how much safer that window, that younger menopausal age group is. So I was looking up some data in preparation for this, just to be really clear. There's no increase in cardiovascular risk. There's a decrease in all-cause mortality. There's actually a decrease in breast cancer death in that age group when it's the estrogen only group. And there's actually a decrease in Alzheimer's and dementia in the estrogen only group in that age group. So with the timing hypothesis, there's actually reduction in a lot of those chronic diseases and death related issues that we worry about. And that's in the estrogen only group there. That was found to be safest. And again, potentially because they used that older synthetic version of progesterone when they did those studies. So just to wrap that up in a nutshell, making sure that menopausal hormone therapy is started as soon as it's needed in that timing window in the first 10 years since menopause and under the age of 60.
Okay.
You want to be clear, people don't need to stop at the age of 60, and that we can reevaluate and we can determine what would be appropriate after that age. But if you're in that age group, now's the time to be considering bioidentical menopausal hormone therapy.
Okay, well, that's really good to know and have that clarification. So I think everyone would love to read through that in detail in the Menopause Brain. So we hear so much, it seems like these days, and so much of the conversation around menopause is about symptoms, my hot flashes, I can't sleep, all of these other things. But if you're, on MHT and it works for you and you're really feeling healthy, what can be some of the upsides to this, transition?
Yeah, it's remarkable to me, the studies that have shown us that women who expect their menopause to be a new awakening, a new phase, an exciting time, a transition that they look forward to, actually have less menopausal symptoms, actually have a happier, healthier, greater quality of life. And so there's a lot of potential preparation, mindset, mental, emotional, spiritual aspects that go along with the physical. I call the midlife a wake-up call. It's a time for us to really start looking after ourselves physically. Of course, good for our entire lives, but really important. And it's a time of new beginnings, a time for us to be really leaning into this new phase of life where we're not thinking about necessarily having more babies. We're not thinking about, the expectations of others around us. We get to start putting ourselves at the center of our lives and focusing on where we really want to go, who we really want to be. And I encourage women in midlife to embrace that wholeheartedly.
Mm-hmm. So that's so good to hear. So it's your mindset that you have going into it that really kind of shapes your experience in a lot of ways. I know Dr. Mosconi mentioned in the book coming across the word start sort of in her research. So it's kind of like it's like a reset, like you were saying, and thinking about what you can do and enjoying that new creative energy and time for yourself. So that's great.
It doesn't have to be a pause button, it's nice to have a pause and a chance to reflect, but it can definitely be a new start.
Yeah. Well, thank you so much for sharing insights from both this book and the practice. There's so much more in the Menopause Brain. It talks about non-hormonal therapies, talks about best recommendations for exercise, sleep, nutrition, even things about avoiding environmental toxins and products that can throw off your hormones. So I think we're going to try to take time for a couple questions from the audience. I'm not sure if anybody have been left in the feed this morning, but we had gotten a ton when we posted this originally on Instagram. So one of the questions, so you're game for that?
Yeah, let's do.
Okay, cool. One of the questions that we got repeatedly, and I know you've talked about this in another live, was how do I lose that belly weight that's sort of crept on when menopause hit. Even though I've been doing everything the same, I'm eating like I did, I exercise, but what's going on?
Yeah, that's such a good question. So I definitely put in a plug for our Pandia Health webpage and the blog. We have some great articles linked. I was quoted in a media article around this exact topic, so lots more to read after today. With respect to that kind of central fat that starts to linger in middle age, you're not dreaming it up. It's actually happening. We want to make sure that we are, I always go through diet, exercise, sleep, and stress. So we want to make sure we're eating healthy. We want to clean up exactly what we're eating. So really, really careful. Mediterranean diet, plant slant has the best science behind it. Fish oils, lean proteins. I describe that to patients all the time. Exercise really needs to involve weight, lifting, muscle resistance, building muscle, because that is going to have greater metabolism so that you don't drop your metabolism, which is natural with age, and also sarcopenia, which is muscle loss, which creates a lower metabolism so that even sitting still, you're not burning as much. So muscle resistance, muscle training, high intensity interval training, like really add those things in addition to the cardio and the long walks. Mm-hmm. And you sleep. If you don't sleep well, your cortisol goes up. Guess what? That's inflammatory. And then you start packing on the extra pounds, sort of as a survival mechanism. And stress management, also related to laying down fat centrally, which is hormonally active fat. So we want to make sure we do that. Menopausal hormone therapy has been shown to help metabolism and to help reduce that central fat that gets laid down. So menopausal hormone therapy is not a weight reduction, but it's absolutely a way to help continue to have that slender shape that everyone's looking for as part of a good foundational lifestyle program.
Yeah, no, that's really great advice. Thank you. So remembering, like I said, weight-bearing exercise, a clean diet, handling stress, and getting good sleep, which honestly is a good recommendation for anyone at any age. So that way you're set up so it's not so much of a surprise. And, when menopause really does start to kick in.
Yeah.
So, yeah.
I see someone asking, I've been watching for questions. We don't have a whole scroll. I see someone asking, what is hormonally active fat? And I just want to describe, when we are stressed and we have an elevation in cortisol, we start to lay down fat centrally, and actually omental fat, which is that fat around the organs. That fat is hormonally active, meaning it creates an metabolic imbalance for us. It creates some insulin resistance, and then it becomes a vicious circle of, I'm stressed, I've got greater insulin resistance, and therefore I have greater inflammation in my body, and it becomes this whole cycle. So hormonally active fat is that central fat, and we need to continue to build muscle, sleep well, manage stress, consider what we're eating and our lifestyle, and some menopausal hormone therapy to keep that at bay.
Yeah, that's a really good question to know, that fat is not just sitting there taking up room, it's doing things in your body. So we want it off as soon as we can. I think another question that we get a lot too is from people wondering, how do I find a good provider who's really a specialist in menopause care?
Yeah, it's such a good question. So many times people are seeing their providers and they're made to feel sort of crazy making, they're made to feel like what's happening to them is not real. Mm-hmm. And it is real. And so a provider who's certified, who specializes in menopausal care, midlife care, is vital for that conversation. They take a real interest in understanding what's happening to women, all the intricacies that we've talked about today. It's not just hormones, it's all the other parts of life. And so finding a good menopause provider is important. The best way to do that would be to go to menopause.org, which is the Menopause Society, previously known as North American Menopause Society. And there's a place you can put in your zip code and find a certified menopause provider, what they're now called Menopause Society certified providers. And you can find one in your area. Right. Pandia Health obviously is online and accessible to women in most states now. And Pandia Health offers also online telemedicine in a way that ensures safety asks, some back and forth questions, make sure that women are appropriate and that their questions are being answered, and can provide prescriptions for menopausal hormone therapy or other menopause treatments. And it's from wherever you have a device and the internet. So I'm really, really proud to be part of that team.
Yeah, that's great having you leading our practice. So, okay. Well, thank you for those questions, everyone. There were a lot, like I said, left on the initial post, and we're going to be working on answering those in future lives and in articles. So kind of keep your eyes out for that. So now we've gotten to the moment you've been waiting for, our giveaway. We're excited to announce our 2 winners who were selected at random from their posts. They followed, tagged a friend, and left a question. So winner number 1 is Stephanie Nicole Abdon, aka a hot Southern mess. And
Yay,
I love that. And our second winner is Trenna Williams Billen. And so her handle is Locks of Imperfections. So
yay,
congrats both of you.
That's exciting.
So please leave us a DM, or we'll send you one and get all your mailing information and get the book out to you, and you're gonna love it. So thank you. I think we're coming to an end of our time together, but it's been really great to connect this morning and talk about this book, and that gives us so much explanation of really what's happening to us from a science-backed, perspective. Getting, insight from a menopause specialist like you, Dr. Hansen, and we're looking forward to our next Conversation Cafe with Dr. Hansen. That's going to be on May 3rd. So keep your eyes out. We'll be announcing more about our special guest for that one and the topic.
Excellent. It's been such a pleasure to be with you, Maria, and all the people who are listening. And all of our lives are on the Pandia Health YouTube channel. The link is in the bio, and also all of the incredible resources and information our team is putting out on the webpage, pandiahealth.com. It's been so great to be with you today, and I look forward to doing this again.
Me too. Thanks. Bye.
Bye-bye.